Okay, hey everyone. So now we're going to check out the code card. At the top of the code card, well, I guess at the very top, usually you're going to have like an ambu bag. That's really important. So that way, if there is a code blue or a rapid response and the patient needs oxygen or they need some breaths, some rescue breaths, you can grab that. And then another thing that's usually at the top is your LifePak machine. So, let's see if this is turned on. Maybe it's on battery. Okay, yes. Okay, so here's your on button, and you can play around with this in the ways that I'm showing you, okay? So you can turn it on. You'll see nothing here because we're not connected to the patient. Hopefully we can get connected to the patient so you can see something here. All right, so if, let's say, they need to, on the LifePak, you can do a few different things. You can defibrillate the patient, you can do cardioversion, or you can do pacemaking. Okay, so let's say you're connected to the patient and we need to do something. Okay, so the LifePak machine can run like a AED machine. So if you were doing that, okay, so that's like, basically anybody with BLS can use an AED machine, right? So the advisory and analyze sections right here, that's how you would operate it like an AED machine. So basically the machine is going to tell you what to do next. Okay, but how you'll see, more likely than not, how you're going to see a code run is from an ACLS standpoint. From an ACLS standpoint, the nurses or doctors or whoever's running the code is the one doing the analyzing of the rhythm and responding based on their analysis. So if that's the case, you're going to have a rhythm on the screen. They're going to follow ACL's protocol. But let's say we've decided that we need to shock the patient. Okay, so there's a few things you can do. You can press energy select. Now we have our energy, so 200 joules on the screen. So you can lower the energy with the buttons, up and down buttons, see how it's lowering? Or, and this is a little faster, you can use the knob here. That's going to increase and lower it, right? Okay. So, for the sake of safety, let's lower it all the way to 2 joules. Then, charge. See, now it wants me to connect the electrodes, so if they're connected, you're going to hear a sound where it's going to go, make a little sound. Then you press shock. And then that's how you go through the defibrillation mode. Cardioversion mode, you would press the sync button. And what it's going to do is it's going to deliver the shock at a particular part of the cardiac cycle. So that's sync. That's how you do cardioversion. Pacer, so pacer is if you want to run this like a pacemaker. Let's say the patient's really bradycardic and we need to get their heart rate up. So we can run it as a pacemaker. If you're doing that, then you have a rate. So, let's say you run it as a pacemaker and the doctor says, let's put it at a rate of 65 or 70. So you can increase it and decrease it. Current. So in pacemaking, you want just enough electricity that there's capture. And capture means that the patient's heart is responding, and when there is electricity being delivered from the machine, the heart is beating in response. So you want just enough current that the patient is responding. So that is your LifePak. Let me see what we've got on the sides here. I'm going to have this set up for you guys a little bit better. But on the sides, you'll find your electrodes. So this can connect to the patient, and then you'll be able to get a rhythm on here. And then you have a blood pressure cuff in there too. And let's see what we've got on this side. Okay, on this side is your defibrillation pads. Let's see if they show you. Yes, they do. Here's a picture. I love pictures because if you ever forget how these things are supposed to go on, you've got a picture here. Okay, so that's the life pack. Let me turn this off. That's important. So what else is important is what's inside the code card. So our top drawer, we have some IV push medications here. They're color coded, which is great. They're usually in standard doses. So you've got one atropine, you've got epinephrine, and you've got lidocaine here. Here's the box. It's upside down. There it is, lidocaine. Okay, so this is how it comes. And really the rule of thumb is take the yellow off and then connect it. Okay, so let me put you guys over here for a moment. I'm going to disconnect the yellow. And I'm actually going to leave the yellow part on the end here. So this is actually the port part. That's what connects to the patient. Okay, but I took the yellow cap off there, and I took the yellow cap off here. All right, so this is used, but it connects in like this, okay? So it goes in like that. All right, and then it's like basically a syringe, really. So you are going to take the yellow cap off, connect it to any IV port, because you've just learned how to do IV push, right? And you're going to IV push this. And you do not need to time it. You just need to get it in so that way it can start working. Get it in fast. Okay, so that is the medications. You also have like syringes. You have all kinds of different meds, but those are the most common. There's intubation supplies. So you have your ET tube here. There's laryngoscopes over here. That just facilitates the placement of the ET tube. There is a CO2 detector right here. CO2, if it detects CO2, that's a good thing. That means your patient is still alive. Alive cells make CO2 as a waste product. You have different suction catheters here. In this drawer, you've got IV fluids, flushes, labels for IV. And usually, there's some drapes here. Usually, you have a NG tube or an OG tube. Sometimes they like to, sometimes if they're throwing up or things like that, they like to put an NG tube in. But that's basically your code cart. So when you come in Explore, this is your equipment that you can learn from and explore. So that's your code cart.